Joe Tighe is a psychologist based in Sydney and is part of the BPsych Psychology clinic in Mona Vale. Originally from Ireland, he now lives in Sydney, Australia, and works to prevent suicide. There are an average of 8 suicides every day in Australia, and that's roughly 3,000 people that we lose each year. It is substantially higher in the Kimberly area of Western Australia and far north of Queensland. Suicide is the third leading cause of premature death from injury or disease, and the main cause of death among people aged 15 to 49. We lose more people to suicide than die on our roads each year. It affects all ages, genders, and ethnicities. Now, Joe is working with many other people to change this. Good morning.
Morning, Jean. Lovely to see you again. Thanks for having me on.
Yes. Now, we met in a suicide prevention workshop. Can you talk about the workshops that you lead and who they're for?
Yeah, the Central and Eastern Sydney Primary Health Network, which is a huge region stretching from south of the Harbour Bridge all the way down to the Sutherland Shire. Central and Eastern Sydney region, it sounds a bit misleading because they go as far west as including the inner west and as far west as Stratfield. So it's a huge region. For the past 12 months, they funded me, and I'm very grateful for it, to run a number of workshops, Living Works Assist and Living Works Safe Talk suicide prevention workshops down there. And thankfully, for the next 12 months, we're going to run another body of the same workshops again. And also they've invested in a new community of practice, a group for graduates of those workshops to reflect on the learnings and build more strength and safety in their communities. So yeah, that PHN region, the training is only for people who work or live in that PHN. It's provided free with extra supports to attend. And that PHN did some of their own consultations and decided that that was the best investment for their government money partially around suicide prevention. Their consultants returned with those kind of recommendations around pure education, evidence-based education, training and building capacity in the community. So I'm a believer in the same when it comes to suicide prevention, educating the public, upskilling the public. So I'm delighted.
I thought it was important in beginning to give people permission and language around talking about suicide, because it's such a charged topic and it's quite scary for many people, and to be able to enter that conversation and to have some language around, how do you even begin talking about it when you think somebody's really depressed or considering suicide? And I just thought that was a really important project to do.
Absolutely. The safe talk, both of them are owned by Living Works, a North American company, been around since the 80s, the 1980s. Both of them provide the safe talk as a half a day's space. The assist is 2 days. 2 days of conversations about suicide, and that's, as you know, that's rare. We need conversations. I'm a huge believer that there's still far too much taboo, too much stigma still. And the only way to break that down is to get people into a room and talk about suicide or whatever the taboo subject might be. We're getting much better. But if we don't talk about these issues, it's going to be much slower to make progress.
And I think if you can talk about something and start processing whatever's going on, right, it's not something that festers or becomes more twisted. You can simply start processing what's going wrong, what help might you need, what are choices you have that you haven't thought of, and start opening out the possibilities as opposed to suicide, which closes all of them.
That's right. And figuring that out as a group is a beautiful process too, and share, people comfortable sharing what they want to share and learning from others. Some people are nervous or have some apprehension about attending a workshop, but the reason I keep going back and the reason all the trainers keep going back to do it is we love the workshops, and mainly because people are feeling empowered, feeling this, they feel the safety that gets created in the group. They actually enjoy a half day or 2 days suicide prevention workshop, and they leave with extra confidence and extra skills, practical extra skills. So that surprises a lot of people, and it doesn't surprise us anymore in the feedback that we get, because that's what we try to achieve every workshop. But it's it certainly surprises some that attend and that I guess don't know what to expect.
Yeah, I mean, I went to the Safe Talk workshop, and I just thought, as intense a topic as it is, it was a really lovely atmosphere. That there was a bunch of people from very different professions who came together to think about how do we support people in our community who are struggling, and that you could start those conversations at work, at school, in family situations or friend situations, and just have the means to begin that. I thought was terrific. And it is empowering in the sense of, I think many of the people in the room had been touched by suicide, had somebody that they knew who'd committed suicide. And I think it gives you a sense of, instead of feeling powerless, knowing that the next time you encounter somebody who's struggling, that you'd have some language, you'd have a place to begin. And I think that is very powerful.
Yeah, absolutely. I'm glad you found the workshop welcoming, and major thanks to Lisa and Alex and Antje, the PHN team members down there who have gone beyond in their efforts to feed people at 5 p.m., give people a dinner when they come in from work, to a workshop after work, probably for many, or after studies, give people a good feed before we even begin the workshop. Well, even financially make it easier for people to attend a free workshop. So
I was very impressed with that. That if you weren't being paid by an employer, that you could get a fee so that it would allow you to take time off work. I thought it was very impressive.
That's right, and it's very innovative from the PHN to take that risk and to spend their money. It's government money, it's taxpayers' money, but to spend it that way to support people to attend. Part of the thinking there was so that we just didn't get social workers and counsellors and psychologists attending who might be salaried to attend. As you've seen, we're getting hospitality staff, bar staff, pharmacy assistants, people, all sorts of walks of life, not relevant what they do for work, but we wanted everyone and to have no financial barrier to attend a half day or 2 days.
Do you see what difference the conversations make? Have you had feedback on that?
Yeah, absolutely. And even the last assist we ran from the previous financial year, we ran it. I think it must be early this month, June. That was a remarkable one. We had a huge turnout again with 25 people, but it was interesting. A lot of people that came had either done the half day Safe Talk previously, or a family member had done Assist or Safe Talk. So there was a huge, half the people there were already connected either to me or to my co-trainer, Chrissy English. And that brought a level of safety that I've never seen before in the workshop. It's kind of a groundswell or a momentum in the region. That's been building over those 12 months of pretty solid workshops. We've ran a lot. And also this new idea of a network of safety that the PHN are also funding. So we meet monthly. Whoever's interested, any graduates from the workshops meet monthly online for an hour. Reflect on the learnings, reflect on use of the skills, do some advocacy for the likes of safe spaces or any other advocacy they think is important to improve the levels of suicide safety in their communities.
I saw something about the safe space in Summerhill. What is a safe space? Tell me a bit more about that. I don't know what that means.
Yeah, they're a great a great initiative. The safe spaces. They're basically venues, and they're all over the state and country. They're basically a venue where any member of the public, without a referral or anything, but any member of the public can pop in and have a conversation with trained volunteers about their well-being, their mental health, their suicidality, and whatever is on their mind. It's safe, a safe venue. They're not in bars or restaurants. They're in community centres. The one nearest to me is in a cafe that's closed in the evening time, the Mind Cafe in Narrabeen, wonderful place. And yeah, the lovely grassroots movements, Roses in the Ocean, and that organisation, they fund the initial startup and support them ongoing in some cases. But many are standalone, and they just provide that non-clinical setting that a lot of people are much more comfortable going into, engage.
Yes.
They don't feel that any level of threat or They could just feel comfortable walking into what's known as a safe space and have a cup of tea and have a conversation with some trained volunteers. And a lot of those volunteers are trained on Safe Talk, which you did as well, or assist as well.
Okay, yeah, that makes a lot of sense, and I can certainly see the value of that, and that many people aren't comfortable going to therapy or simply can't access it or have the financial means to do that. So having other spaces where you can have those conversations, perhaps in a less formal way, is very valuable. I can certainly see that. Yeah.
And related to them are the safe havens. And they're a wonderful new initiative. The safe havens, which are they are still funded by New South Wales Health, sometimes on a hospital ground, sometimes not. They're a kind of a step up from the safe spaces, where people that may have traditionally gone to an emergency department with mental health issues or suicidality, the safe havens are now an option. They're not open 24/7, unfortunately, not yet. We'd love to see them having that, but people can go there, and there's peer workers there, and there's set times that they're open, and they're another wonderful. They can access the health service via the safe havens if need be, but again, a non-threatening, safe place for people to go with mental health struggles.
And that would take a lot of pressure off the emergency wards as well.
That's right. And the emergency staff do wonderful jobs, but sometimes they don't have a second to attend to people, and there could be long wait times. And mental health often is invisible compared to some of the injuries that get presented, and they might not get the same kind of urgent service.
Yes. Yep. That makes sense. Now, from your accent, I'm guessing you're from Ireland. Where did you grow up, and what was your family like?
I grew up in a small town called Trim, Ballyough Trim, in County Meath, which is just a little bit north, about half an hour, a little bit more northwest of Dublin. Probably most famous for its 1,000-year-old castle, where the movie Braveheart was filmed. Part of that movie was filmed. I was coming out of college and did a few months labouring work on that movie, which I don't think I've been paid as well since, but it was good. It was a good experience for us, for the chance to get to hang with some of that Hollywood. Hollywood doesn't come to many sleepy towns in Ireland too often.
Yeah.
That was a beautiful town. Lucky to up there. My parents were returned from London when my mother was pregnant with me. So my older siblings were born in London, and then we grew up in Ireland. So it was pretty quiet. This was before any boom happened in Ireland, before the Celtic Tiger boom. So it wasn't a very wealthy country at that time. It was tough times.
I lived there in the early 70s too, so I understand. Yeah.
Well, that's when I was born in the early 70s, and so you saw what was what there. But thankfully, they've made a remarkable recovery in terms of economics.
Now, just tell me about your training, your background professionally.
Yeah, well, I first came to Australia when as a backpacker. I was 25. My first degree was in information technology, so I was a computer geek when I first my first career, and part of that was choosing something in university in Ireland, where something that was deemed practical at the time. This was just as the internet was emerging in the early 90s. So choosing tea was regarded as a trade by me, at least, and I was confident I'd get some work in it, and that was vitally important compared to maybe some of the other things I would have liked to then study, such as the humanities or archaeology. I wasn't a very good computer geek. I wasn't particularly interested in it, and it was so useful to allow me to migrate to Australia, and I got some work. But working for the big Australian banks to make them more secure didn't really excite me. If I wasn't really interested in it, I knew I wouldn't be very good at it.
Yes.
I retrained. I just kept training. Education was a huge. My mother was a teacher, and her grandparents, and I think great grandparents. So there's a long line of educators in my family, and education is a real strong value in Irish society. Yeah. So I just kept learning, and I enjoy learning. So did a psych degree and my internship in the Kimberly, and went on to do a PhD at the University of New South Wales under the great professorship of Helen Christensen and Fiona Shand, two local esteemed professors. And two fantastic women who were able to drag me through a PhD.
What was your PhD in?
It was key to be able to merge some of my IT knowledge with mental health and counselling knowledge. So we created the world's first app to be tested in a randomized controlled trial for suicide prevention, and it was trialed while I was living in the Kimberly region, living in Broome, and trialed with the support of local Yarrow people there, elders and youth that were willing and able to take some risks around trying technology, take any risks, almost calculated risks, due to the, as you mentioned earlier, the high rates of suicide in that region. And we're really looking to try anything. I wasn't looking for a research project or a PhD. I was looking for technical solutions, technical interventions. And then we saw they didn't exist, particularly for Aboriginal and Torres Strait Islander people. So we created one and gave it a go.
Okay, tell me a bit about Western Australia and the Kimberley, and what life is like there, and what are the problems that those people are facing.
Similar to the whole top end of the country, or anywhere where there's higher levels of poverty, isolation is a huge issue. With Broome, where I was living, beautiful place, and I'm so grateful for having so many opportunities that came from there, and relationships that I still have. I've left there 10 years ago. It's a remarkable part of the world, the Kimberley, remarkably resilient local people, and that have endured harsh living conditions up there for a long time since colonization. The isolation up there is an issue. The lack of services, of course, like anywhere regionally or remote areas in the country. Go west, New South Wales, and we're dealing with similar problems around access to healthcare, distance from hospitals, lack of mental health professionals, psychiatrists, psychologists, counsellors.
Yes, I suppose in Sydney we can go to a physio, we can go to a doctor, we can go to a counsellor, and we've got so many services within 45 minutes that they simply wouldn't have access to.
That's right. Aboriginal and Torres Strait Islander people have such an innate, strong connection to country. I'm not speaking on their behalf, but many express that they feel more well, they feel stronger when they're on their own country, in their own community. That sense of wellness is at its strongest there, from what I believe, or what I've learned and heard. Often in those areas, there might be a clinic. There's often a small clinic in a big enough remote community, but the resources are very limited in terms of healthcare. So
just explain how long you were there and what exactly you were doing.
Yeah, I was there 8 years and working for a men's service, the men's outreach service there, mostly working as a counsellor and a provisional psychologist up there, largely with men and their families. So men that were in need of mental health support or had been incarcerated, and I'm working with some men that were still incarcerated in Broome and Derby prisons, and their family members, children or partners that needed support as well in a counselling and education space as well. So we ran plenty of workshops, including these suicide prevention workshops, but other workshops around healthier choices, healthier living, alcohol and drugs, and family and domestic violence, behavioural change type workshops.
Now, on the flip side, it's a very beautiful part of the world as well.
It certainly is. And
I mean, it sounds like there's lots of doom and gloom, but it's also an astoundingly beautiful area.
Oh, it's an incredible area, a powerful place with some powerful energy there, and particularly in Broome, where I spent. Everyone's biased to where they like, but most of the time I spent in Broome. Yeah, I spent about eight years there. My daughter was born there, and we moved to this side of the country shortly after she was born. My professors, Helen and Fiona Shannon, Helen Christensen, said, I think they said to me pretty clearly, you won't finish a PhD with all those hippies in Broome. You need to come over to the East Coast again and get surrounded by the brainiacs, the academics, and you might get it finished then. So they were right, as they were pretty much all through the PhD with their wonderful advice and support. Yeah.
And now I see on your LinkedIn profile that you worked as the executive officer at the Australian Human Rights Commission for more than 2 years. What was the work you were doing there, and what does the commission do?
Yeah, the commission does amazing work around supporting the public nationally around any complaints or issues they may have around discrimination, be it age discrimination around disability or gender or race. The public can make complaints and get their complaint heard and heard in the most professional way possible at the commission, and be it large or small complaints. They ran the Aboriginal and Torres Strait Islander Close the Gap campaign, a huge national campaign made up of about 52 member organisations, Indigenous and non-Indigenous, huge organisations like the Cancer Council, the Fred Hollows Foundation, Beyond Blue, and lots of Aboriginal and Torres Strait Islander organisations as well. But it's remarkable that mix of black and white organisations were working together with one single goal, is to close the gap and multiple gaps, and keeping pressure on government. So that was housed at the commission and led by June Oscar, who was the Aboriginal and Torres Strait Islander Social Justice Commissioner at the time.
And just to be clear for people who don't know Australia so much, Close the Gap was about lifting conditions and support services for Aboriginal people.
Yeah, very, very broad now. I mean, the stark and sad realities. Initiatives started about 20 years ago due to the huge life expectancy differences between Aboriginal and Torres Strait Islander peoples compared to the rest of Australians. And at that time, I think there might have been a 17-year age gap for men.
That's
So
huge.
men dying 17 years
Younger.
younger. Tragically, it's tragic because it's still the reality today. Dying from preventable health conditions like rheumatic heart disease. I think we might be the only Western country in the world where preventable eye disease is still not eradicated, particularly in the top end of the country that we talked about earlier, which is a shameful position for a country as wealthy as Australia. These gaps that we're talking about are incarceration rates, birth weights, the suicide rates, the mortality rates that people are dying. And so a huge range of broad health factors that governments have been trying for decades now to close these gaps, but they've really struggled. And the large part of the struggle is because they haven't listened to the wisdom of Aboriginal and Torres Strait Islander people on the ground around their own solutions to close these gaps. They know what's best for the communities. They know what health means for them better than any government bureaucrat. And unfortunately, their voices have not been heard enough. It's slowly changing. Some reforms and a new agreement with Aboriginal and Torres Strait Islander peak bodies, new agreement with government, but governments are slow to reform and slow to change and slow to hand over that power to listen to the people who really know. But hopefully we're moving in the right direction, albeit very slow. So
Yes.
I got the opportunity at the commission to work with June Oscar, who remarkable lady from the Bunaba peoples in the Kimberly region, who I knew June's amazing work around alcohol restrictions while I lived in the Kimberley. And when I saw an opportunity to connect with her at the Human Rights Commission, I took a break from the psych work and stepped into that social justice space, which is something I've always been passionate about. Looking at the broader social determinants of health and mental health and suicide rather than this biomedical Western model of depression. Let's try some antidepressants, and that might ease things. The Indigenous wisdoms of holistic health and looking at the social determinants of health and what social and emotional well-being means is a much smarter lens to use, I think. So yeah, working with June and her team, remarkable people at the commission, was a good experience and a nice connection to culture.
Yeah, I can certainly say that we need to listen to the people we're working with to see what's appropriate for them and what they actually need. And that you could waste a lot of money and do things terribly wrong and not make a difference by not listening and saying, you must do this, or surely you need this, rather than listening and giving support to in a culturally appropriate way.
Yeah, absolutely.
Now, I see you work as part of the BPsych Clinic, a network of 24 therapists based in 5 locations around Australia. Can you talk about how that came about and how you work with them?
Yeah, very lucky here at BPsych. I've been here almost four years now. Everyone is self-employed here, apart from the owners. We run our own businesses from within these walls. We have clinics all over Sydney, down in Bondi and Maroubra, the CBD, as well as here in Mona Vale and the Gold Coast as well. just a lovely, warm, accepting and open environment to work in, with good support from our two directors, two Brazilian psychologists, two sisters. This is where the Bilibio comes from, their family name.
Bilibio.
My Portuguese isn't great, Jean.
Yes.
So don't quote me on that.
Biopsychology clinic. Thank you.
Yeah, and they're great advocates. The leadership here for this month, for example, men's mental health month, and they're great advocates within the community to promote, obviously not just their business, but to promote wellness and in its broadest terms. So we have dietitians and naturopaths working here as well, not just psychologists. We have people with counselling backgrounds as well, student counsellors, provisional psychologists, and many of us offering bulk bill services as well, to kind of remove cost barriers for people accessing care, and good partnerships with couples counselling centres, some of the local domestic violence resources for women. Some good partnerships there, and trying to provide support for people that are caught in those situations.
Okay, what's the website, just so people can read there?
BPsych.com. Let me grab it. It's the hard one. It's bilobiopsych.com. So it's BILIBIOPSYCH.com.
Okay, great.
You can
That's good. Yeah. Okay. And Thorilli, Indigenous Suicide Prevention Service. That's Australia's only Indigenous-led and controlled suicide prevention service. Can you talk about that?
It's nationwide, I believe,
Okay.
and expanding to do. I know that most of the work is what you might call post-vention. Bit of an unusual word, post-vention. So largely that is work that is done after a suicide, a completed suicide, or after a serious attempt of suicide. Right. So it's pretty tough work as a professional to do, and you're engaging with family, friends, anyone affected, the bereaved. It could be within hours or days or weeks or maybe months after a serious attempt or after a completed suicide. It's providing vital supports to people. It also identifies any further risk, particularly in a school setting where there's been examples of clusters of suicides, identifying anybody that might be at risk and trying to provide support. It probably doesn't fall into the counselling category because things are so raw in terms of the grief in the early stages. As you know, the suicide grief has a unique toughness, a unique rawness to it, which is why we work so hard to try and prevent them.
Yes, yeah. What brought you into this work? Most people that I've seen in trauma recovery and suicide, that there's been something personal that has drawn them to feel the need and the power of making a difference.
I suppose, my reasons for leaving a career in IT to move into the world of psychology and counselling was because it's much more meaningful to me. I enjoy the work. I enjoy the one-on-one work. As we've discussed privately, we both enjoy the fact that sometimes you can have a little impact, sometimes a big impact in a 1 hour session with somebody. And you get that immediate gratification of seeing somebody improve and helping people to see that their well-being is within their control, helping people to get to a better place, whether they're suicidal or just struggling with some of the usual things that happen in life, from breakups to financial issues to illness and injury, just helping people get through that. It was very meaningful for me, and I feel very grateful to share people's stories. I'm astounded that people can walk into a room and meet a stranger, share some very vulnerable aspects of their life, and then pay them for it. Usually, I'm astounded that this works. That this is actually a thing. It always surprises me, but I feel very lucky to be able to share a space with people, and feel very lucky that people would trust me to help them make some changes in their life. So in terms of the suicide work, so that's my reasons for getting into psych. And when I got my first job in the Kimberly counselling, the biggest issue, the biggest elephant in the room was suicide rates. So I could have chosen to be aware of that and counter it when needed, tackle it head on. It made sense to me
Yeah.
to tackle it head on. It was this astounding rates of suicide week in, week out, losing young and old, black and white, to suicide in the region. A lot of non-Indigenous people suiciding in the top end as well, due to remoteness, due to isolation, due to breakups of family and all sorts of tough living conditions for non-Indigenous people as well. So we decided to tackle it head on, and to tackle suicide in a creative way up there, using local sporting team, the wonderful Broome Saints. And again, back to leadership, the president at the time was a wonderful community leader and elder, David Pigram. One of his skills is he's part of the Pigram Brothers musical group, who I think are one of Australia's greatest. David was leading the Broome Saints, the president of the club, and a very wise man. He saw an Aussie Rules football club as much bigger than kicking a ball around. He saw the impact it could have for improving health conditions. So the great football coach Neil Burke as well on board. He another wise man, and we really maximised that community of practice. The fact that we had a football club and a huge community behind that, Broome Saints, the best club in Broome. And they, everything from wearing seatbelts to combating drink driving, to family and domestic violence, to suicide prevention, we tackled as a club. David largely tackled it. I helped him with the suicide prevention work. We co-founded a project called Alive and Kicking Goals. Where we would start having these conversations about suicide. First of all, with the local football team, with the Saints, up there after training, having a barbecue, a couple of pizzas, sitting around a fire, doing exactly what we spoke earlier, having conversations, because the conversations weren't happening.
Yeah.
So many people were dying by suicide, but it was a little bit hush hush, and somebody would point out where suicide happened, and a tree might be there one day, and that tree might be chopped down the next day due to the suicide, and that might be the end of it.
Yeah, I understand that. And my mother-in-law committed suicide in my husband's family, and 10 years later, his son committed suicide, and the family didn't know how to talk about it. And things can fester, and then the kids don't know how to deal with that or how to think about it. And
that's right.
It's so important to have those conversations and help people reframe what a suicide can mean.
That's right. And I grew up in Catholic Ireland, where in the eyes of that church, I'm not religious now, suicide is a sin, and still is a sin in the eyes of the church. I guess a generation or more ago, and here as well in Australia, you couldn't get a church service after a funeral. You couldn't be buried in the same graveyard as others after a death by suicide. That's all changed now, thankfully. But what did that lead to? That led to shame, shame within the family. That led to stigma, led to silence. And in that silence, there's no processing of some of these hard conversations. And so many people carry guilt and blame themselves as a result of a suicide. People, for decades, people can carry this sense of guilt and blame. And part of that is the absence of a safe space to talk about it, to process it, and not own somebody else's behavior and somebody else's action around suicide. Yeah, so the conversations are critical. So we tackled the elephant in the room. We tackled it head on in Broome with Alive and Kicking Goals, and they're about 15 years ago, and they're going in 2008. 17 years ago that was co-founded, and they're going strong. The team getting bigger and bigger. All Aboriginal and Torres Strait Islander led. Peer education. One of the issues there at the time was that a lot of Aboriginal people in the region were quite wary of seeking mental health support, even in the biggish town of Broome. That it's been well documented, plenty of evidence that racism within the healthcare system is rife, or was rife, and still continues. And a special form of racism reserved for Aboriginal people, as many academics have said. And a cultural lens of some Aboriginal people believing that, some of the older ones particularly, believing that hospitals are a place you go to die, rather than a place that you go to get well. When they're dying so young and not returning from hospitals, you can see where this came from, and a medical model that is not necessarily aligned with their own belief systems and their own healing and medicine systems that have worked for.
Yes. Yeah. Well, if you haven't been able to access care that would heal something and then go on, I could certainly see how an attitude towards hospitals that would develop. Yeah.
Absolutely. And certain belief systems as well. So barriers to care, and the Alive and Kicking goals was a bit of a bridge to bring professionals in with peer support and peer education. Encourage people and support people to get that mental health care from some of the good services that existed, state-based services that existed in the town. At that time too, there was no acute ward for acute clinic or anything, or hospital for mental health presentation. So people had to fly to Perth, which if they needed to be hospitalized for mental health, they had to go to Perth at the time. Thankfully, there's a small enough service there now with a number of beds that and the creators of it, or WA Health, did their best to make it as culturally safe as possible. Hopefully they've achieved that. I don't know.
I wanted to review what the resources, education sources, workshops are available for people who want to make a difference to change the rate of suicide or to access services themselves. So there's Safe Talk, that is a way of educating people. The workshops, half-day workshops, is that correct?
That's right. So let's start at the beginning with the shortest one. I'm only talking about Living Works workshops and products here because they're the only ones I work with. There's other ones out there, but I'm familiar with these, and I don't work for Living Works, so I'd like to think I'm not biased. I only run them because I know they work.
Yes.
And they're very practical, as you saw. These are about skills. Similar to physical first aid, we want millions around the world, and millions around the world have been trained in these skills. So,
yep.
So Living Works START, START, is a 90-minute online workshop for skills to learn conversational skills, how to talk to somebody who might be at risk of suicide. That's 90 minutes, still available. I believe it's free until the end of June and very reasonably priced. That's 90 minutes. And even though it's online, it's very interactive and very good. That's 90 minutes. That's the minimum. And then we move up to a 3-4 hour Safe Talk half-day training, where, as you saw, you get to practice the conversations, ask people clearly about suicide. Is the only way we can find out if somebody's suicidal is by asking them clearly. And if they are, we link them to help. So that's what we learn. And before that, obviously, some of the signs, what we used to call red flags or warning signs around suicide, be it people isolating or abusing alcohol or drugs or acting differently. Now we call them invitations, the language of invitations, where people are inviting us to check in on them. Are you okay? Type check-ins. And to check in on how people are going, and then ask them clearly about suicide. And then finally linking them to safety, linking them to help if they agree to help, be cooperation. They're the three and that's the ASSIST. ASSIST stands for Applied Suicide Intervention Skills Training. And that sounds pretty formal. What it really is learning how to have a conversation about suicide and then potentially about safety.
Great.
Critical skills. And similar to physical first aid, we want people from all walks of life trained in it. We don't just train doctors and nurses in physical first aid. Every Joe citizen should be trained in it. And same with suicide prevention, conversational skills. We know there's a much higher chance you'll use the skills in a suicide prevention workshop rather than a physical first aid workshop. We ask people who's done CPR or some serious bandaging, and hardly anyone has it. Thankfully, we have this. We can when needed. But then we ask people, have you ever had a conversation with suicide with someone close to you, or a client, a service user, family member? And, half the hands in the room go up. We can have these conversations regularly if we have the confidence and the skills, which is what education brings.
Yeah, from what I'm hearing is that these conversations make a big difference, and empowering people, these skills are actually being used after the workshops. Right. It's actually important skills that people are going out and using in the community with their friends, their family, their workmates.
Big time. And I do some workshops with Lifeline on the Central Coast. So Lifeline Hunter in New England, led by the great Dr. June Anderson and Katie Allen, and they follow up. They follow up every participant after their ASSIST workshops. I'm not sure if it's within 2 or 3 months they follow them up, and they're doing their data collection, and they're asking how many people have used these interventions, and they're into the thousands of people that have actually used the skills post workshop in a real life scenario. within a few months of actually completing the workshop. I did a workshop recently, and a young man came in. It was for stay in Australia and in Sydney. And a staff member attended and said he's done assist before, but no conversations around suicide were happening in his workplace then. He said, but I'm back to do it again now because I'm having plenty of these conversations, and I need to know what's the best practice. Outside of the suicide prevention, you mentioned resources. There's a good website, Head to Health, a new government initiative, and you can filter down around the kind of help that you need and where you are. And they're linked with the new Medicare mental health centres, which are a good new initiative as well. These mental health centres, Medicare centres, they're called, that people can drop into without a referral. They're pretty new and a good initiative.
Well, anything else you want to add? That's been comprehensive and an amazing story of what has been going on in Australia and the many programs that are making a substantial difference. That's hopeful and positive in an area that's difficult and wasn't tackled previously.
Yeah, I might just add about the value of lived experience, Jean. You asked me my reasons for getting involved with this because I needed to. I thought that was important to jump into the suicide space, but I did that with the partnership of people with lived experience in the region. At the time, it was young footballers from Broome Saints, some of them teenagers who lived the experience of suicide. They lost family or friends, and sometimes multiple, or they had an experience of suicide attempts. And the courage of people with lived experience to step up and say, you need to listen to us. We know what we're talking about. We may not have the degrees, we may not have the qualifications, etc., or the fancy letters after our names. We arguably know more about suicide than you do. They're right. So the real importance of listening to lived experience. Many people involved in these safe havens and safe spaces have a lived experience as well, and they can provide a space to have really rich conversations. And so I respect the courage that people with lived experience have to keep communities safer.
Yeah. Well, thank you very much for coming to talk to me. I really appreciate it.
Thank you, Jean. Appreciate your time. Thank you for help spreading the word in Mental Health Month as well.
Yes, yeah, that's important. Yeah.
Yeah, and just one final thing on this, Jean. We hear a lot about men's health and men's mental health, and some of it the media don't report all too accurately. Indeed, 3 out of 4 suicides in Australia are male. 3 out of 4. That gets sensationalized a bit, and what we don't hear is that women are attempting suicide more than men in Australia. So women are attempting more than men. Men are dying by suicide more. They're using different means, more dangerous means. So I think it's important to highlight that balance that is across our society, the issue, young and old, and all genders, and not to try and pigeonhole or sensationalize with an absence of the real data.
Yeah. Thank you.
Okay. Thank you, Jean. Thank you for your time.